On this video today, I'm going to show you what make you to have urinary tract infection, UTI, and yeast infection at the same time. And also the causes, symptoms, and treatments. Hi, everyone, it's Dr. Alan here again. From Health and Fitness Advisor, where we post videos answering your health and fitness questions that might be bothering you. And also teach you on how to get your sound health back. And in a simplified manner. If this is the first time you've come to our channel, please go down the bottom and hit that subscribe button. Turn on all the notifications so that we can grow together in sound health and you don't miss out on any of the good stuff that is happening here. UTI and yeast infection go hand in hand. Usually, there is a link between the two that is not clearly explained. We will try to describe the connection between the two. And how they relate to each other. A yeast infection is often seen in a person's lower region. It will usually appear as redness and soreness in the infected area. It can also cause burning sensation when urinating or using the bathroom. If you are experiencing any of these symptoms, then you should consult your doctor right away. However, you can experience both conditions at the same time. This is called a Candida infection or urinary tract infection, UTI. UTI and yeast infection will often go hand in hand, especially if you are an adult and already suffering from a yeast infection. In most cases, a Candida infection is caused by a genetic factor, and if it happens to the first time in your life, it may only be a yeast infection. This condition occurs in the lower abdomen of most adults, and can be contracted through sexual intercourse with an infected person. However, a yeast infection can also be acquired from food items, and if your body is exposed to a weakened immune system. Since urinary tract infection, UTI, and yeast infection happen to go hand in hand, we will look at the symptoms of UTI and yeast infection. There are different factors that make people more susceptible to yeast infections. Those factors include diabetes, weak immune system, overweight, age, and pregnancy. As mentioned earlier, urinary tract infection, UTI, and yeast infection will often go hand in hand. In fact, there is a connection between the two conditions that cannot be explained, though. But you should be aware that you are likely to get both at the same time if you have all the risk factors discussed above. Having a weak immune system can also give you the possible yeast infection. Especially if you are already suffering from a Candida infection. This can cause both urinary tract infection, UTI, and yeast infection to occur at the same time. That is why you should always keep your immune system strong and healthy. Pregnancy and diabetes can also cause you to have urinary tract infection, UTI, and yeast infection at the same time. When you are pregnant, you will have a lot of hormones that causes you to become more prone to infections. Also, diabetes can make you more vulnerable to infections, because it affects the functions of your blood and heart. Another risk factor for urinary tract infection, UTI, and yeast infection is obesity. Obesity is the main reason why people get infections. Obesity also gives you the risk factors of diabetes and other infections. If you already have one infection, and you have been on antibiotics to get rid of it, this will have an effect on your immunity system. So, your body is not able to fight the infections anymore, and you get a urinary tract infection, UTI, and yeast infection at the same time. Not everyone who suffers from urinary tract infection, UTI, and yeast infection should be treated with antibiotics. You should have a regular checkup with your doctor, and see if you have been exposed to the infections, and how long you have been suffering from them. And also, you should be careful to wash your hands, because you might be exposing yourself to other infections when you use your hands to touch the infected areas. Urinary tract infection, UTI, and yeast infection are linked in most cases. If you have an infection, and you are already suffering from urinary tract infection, UTI, you should visit your doctor to get a confirmation. Also, you should get a regular checkup with your doctor, and see if you have been exposed to infections that will cause you to have urinary tract infection, UTI, and yeast infection at the same time. If you enjoyed the video, make sure you smash that like button in appreciation, go down the bottom, and comment to let me know what you thought of this video. And don't forget to also check our blog. The link for our blog is in our description below this video. Let us know how we can help you, for a better health, and more importantly so we can grow healthy together. Thank you so much for watching another one of our videos. I'm Dr. Alan. From Health and Fitness Advisor, and until next time, please stay safe, and goodbye.